where beauty meets brains.
Now, several weeks ago when we first announced the podcast, we started talking about surfaces that were going to trend in the next decade, things that you're going to see more of and that are showing a growth. And chemical peels happen to be one of those things. So less downtime, great results, minimally invasive. So that's what we're going to talk about today.
The great thing about chemical peels is most people can have them. That's the beauty of it, is it's not confined to, you know, one or two different types of people that can actually do these. Most people can do a chemical peel. So
it's a training that you do. And she's saying like staff wise, like most of the individuals and patients.
I'm actually talking about patients. Most patients can do one. There's very small things that can limit you from receiving a chemical peel, but there's so many benefits that you can get from a chemical peel.
Right.
It really depends on, in my opinion, what problem that you come forward with, how severe that problem is. That will depend on what chemical peel that you choose.
And then
most
of course
the time.
what the med spa offers.
Right.
Because they may say that you're not a candidate for one or the other. Like for instance, where I was in the past, we only offered the ZO3 step, and you have to precondition for best results with that. Otherwise the peel is like,
it's very painful.
It's very intense.
It's very intense.
That's why you want, you know, for best results and through the healing process, for somebody to use retinol 4 to 6 weeks prior. So I had limitations there because I didn't have people really following the protocol, whereas we offer several different types.
And we do that, excuse me, we do that purposely because just like all of our other products, one product is not going to be great for everybody. One chemical peel is not going to be great for everyone. So like we were saying, you know, it really depends on what issue that you have coming forward. And really what depth you want to go, what kind of downtime are you available for, what does your financials look like for this treatment. I mean, there's a lot of things that can go into determining what chemical peel that you want to.
And back to the staff thing, like it's something that your esthetician can do, your nurse can do, your nurse practitioner can do. Like the legalities there, like when it comes to facials, a nurse, even though you're a nurse or a nurse practitioner, you cannot do facials. So with the legalities for a clinic, it's a really good treatment to add because you have multiple people that can step in and you're not going to be without it. So it's a good one for the clinic.
And I love, yes, it's a great service to bring on as a clinic, but also for me, I've trained a lot of people as far as like estheticians to do these, and something new for me is having injectors that can do these too. What I like about that is they can put this chemical peel into their skincare regimen or their plan of care for you for the next year in cahoots with your dermal filler and everything else. It just makes everything else, they have a bigger plan.
Right. For instance, like I am an injector. If I have somebody with acne scarring, you know, we can do microneedling for resurfacing, but I can always start them off with a chemical peel to jumpstart the process, so that way these other modalities work great alongside that and get some results quicker. So I love a chemical peel. This is chemical peel season.
It sure
That's why we're talking about it. Like now's the time to get your chemical peel. We're not out in the sun, sunbathing. I mean, it's just a great time to avoid the side effects that come along with it, and it's a good time to just like get ready for the holidays. Like your skin will glow, your makeup will go on better. It's just a good jump start to the new year, but also just to get that skin looking really good for the holidays.
And you know, a lot of people, we're doing this podcast to help educate people on why things in aesthetics are what they are. And you know, it's chemical peel season. I'm sure a lot of people want to know why that makes it chemical peel season.
Right.
So a lot of the times, all the time, if you get a chemical peel, the purpose is to slough off that dead top layer of skin that has been accumulating over however old you are, however your cellular rate is. That just will depend on how much is going to be there, but you're going to have that baby skin underneath that is very, 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 very sensitive. Very sensitive. So you don't want the sun to be on your skin. It's going to damage it. It's actually going to be worse than...
And plus you're trying to fix the damage that you've
Right,
created.
right.
So like you've been through the summer, you've caused more damage to the tissue, more sunspots. So now you're here to erase some of that and start fresh and get that skin looking really pretty again.
Exactly.
So statistics show, the American Society of Dermatology shows that 1.3 million chemical peels are done annually, making this one of the top non-surgical cosmetic procedures. And that during the wintertime, obviously, 25% increase in people getting them done, because a lot of us don't have the time to be out of the sun just in just general, you have kids playing sports and just wanting to get out and enjoy the pretty weather. So this time of year is the perfect time because you can get out and about. I mean, obviously you're still protecting your skin, even if, I mean, we still have sunny days. We live in Tennessee, it could be 80 degrees one day, but more than likely you're not in that situation this time of year.
And something else that people don't realize, I'm pretty sure you taught me this, and I think we were talking about why is it busier during the winter and things like that. And of course it's all these things that you just stated, but another thing is you have on long sleeve shirts, turtlenecks, your floating head,
shining.
and everything that you see is on your face, and you
Plus,
point it out and see everything in the winter.
in the summertime, like we're tanner, just everything I feel like looks better tan, obviously. So we do spray tans now because we don't want skin cancer, right? But just like we feel dull, our skin is drier because of the weather. So everybody's looking for these modalities to just feel refreshed and pretty. And we have all these social events coming up. So what can I do that gives me the shortest amount of downtime to get me what I'm, looking for? So in our clinic, we offer several different types of chemical peels for somebody who doesn't have the downtime and just wants a quick fix, to somebody who's trying to get rid of, like I said, acne scarring or deep wrinkles or resurfacing. So we're going to talk a little bit about the different types of chemical peels. I think the word chemical peel scares people because as soon as I mention, I can see people like straighten up because they think they're going to have to do that big, sheet peeling, have to cut it. But there are different options for different people. So,
and I can actually go further on that because I was one of those people. I am an extremely dry-skinned person. I peel just regularly. I'm very, very dry. So in my mind, even being in the field that I've been in for 7 to 10 years, I still haven't had a chemical peel until last year. And it was because I was like, in my mind, I imagined being very raw. I was going to chafe almost be chafed in areas, be very raw and painful.
Well, you're sensitive and dry already, so.
And a lot of people,
peeling
exactly,
to the extreme.
Exactly. So, and then I finally had an esthetician. She was like, no, do this peel. I promise you all the problems that you don't like about your skin. And for me personally, it was texture around my mouth and pores, the pore size on my nose and texture that it did not matter how much I microneedled it, it was not resolving. And what I found out was that all this dead skin that I was peeling or sloughing, it needed to be extracted from my body. It needed to be taken off, and I didn't know that. And I love my skin more after that chemical peel than I think I have with any other service.
I loved my chemical peel. And I tried a new peel this year. I was always doing the Perfect Derma, which then, I got pregnant, I was breastfeeding, and then I just hadn't used retinol in so long. So I tried to start back my retinol to do the ZO 3-step because that's what I was used to. And it just was not, my skin has gotten so much more sensitive. Obviously, I've been out of my routine because of pregnancy and breastfeeding. So that's why we kind of initially got the Perfect Derma Peel, because I'm a peel lover. And this was just like a good answer. I don't have to prep my skin. It's great for all skin types. I mean, you're getting rid of, I had melasma obviously from pregnancy, just hormones. I had all these different things that I wanted to alleviate quicker than the products I would have to go back to. Just give me a jump start because I've been off of them for so many years. And so I tried out the Perfect Derma Peel, and I actually have videos on my Instagram if you're interested in going there and seeing. I have like my entire peel process on there. And it's time for another one, so stay tuned. But I loved the results. Like, I loved the quick fix, and I felt bright. I felt like I could go to school and drop my kid off without my under eye cream on and my makeup and not look like I'd just been, beaten and climbed out of a ditch.
Yes, I completely agree.
I love the refresh look you get and the jump start to just like glowing skin. You just feel pretty.
And the reason is we have this thing that we really need to keep up with, and it is our cellular turnover rate. So let's say cellular turnover rate. It's important.
So important.
It's so important. So let's say you are a 23-year-old female that walks in here. Now, we don't have it down to a science of down to the day, but it's around, 20 to 28 days is how long it takes that top layer to slough off for that new cells, all that new skin to come to the forefront. If you're 30 to 40, you're looking at 30 to 40 days, somewhere in there. Every decade, it's going to be another 10 days.
Right. So that's why baby skin gets its name, is because their cell turnover is like a week to 2 weeks.
Yes.
And so even if they have that little baby acne, it's gone and their skin is just beautiful because their cell turnover is so quick. That's why their skin looks the way it is. And plus, it's red. Their skin. But as we age, our body has more important things to do, and that cell turnover rate slows down. The signs of aging is occurring. We've got fat pads changing, we've got skin changing, we've got hydration changing. So when you get on your skincare regimen, people like will only do it for 2 weeks, but I don't see a difference. Well, you haven't turned those cells over, nothing's happened yet, and it's not the skincare's fault, it's your age, unfortunately, like everything else.
Your skin is like, we've been doing the same thing for
Yeah.
33 years. 2 weeks is not going to change
Right,
us.
and plus if you've been not using products that actually help those cells turn over and actually revitalize that tissue and heal it, then you're gonna purge, and that's normal. So I think it's just education and teaching your clients, and clients asking questions and making sure you're getting the answers so you understand, like, what do I expect, when should I start seeing results, but also here's X, Y, and Z that bothers me, is there something I can do to jumpstart? And that chemical peel usually is the answer. And then you get on a great skincare regimen and you're ready to roll. But it is, I see like somebody who doesn't know anything about skincare
Sure.
being, scared
Sure.
to jump into something like a chemical peel. And it's just the word. And we'll talk about, you can baby step into this.
That's what literally my next thing I was going to say, that a good way to get them started is most of the time they're going to start with a skincare regimen. You know this.
Yes.
It's the least or a facial. It's the least invasive. How can I dip my toe in the water but feel a little more warm and fuzzy about this? So you really want to make sure that your first sale or your first conversation with them is going to be very educational on why we're doing what we're doing. They're, like I said, they're going to get their skincare regimen, which is great because it kind of puts them on a jump start to this chemical peel. Once they get this skincare going, they're seeing results. It's like a positive feedback loop here where, okay, everything's going good. Now they're going to be a little more apt to do a chemical peel. And I would always start, once again, depending on what issues they had, I would start with a lower one just so they could see what it felt like. Something like a lactic.
Yeah.
They call it the day facial, the day chemical peel. The lunchtime peel, and that's because you can literally come in, it takes less than 30 minutes, you're going to have like a light retinol slough the next day, or even that day. It could happen as soon as that day.
But it's a good one for like right before events, or like she said, baby step into it, because your skin is going to look noticeably glowy.
They're going to get enough of a difference to want to do something else, but they're also going to get results for them as a client as well.
And we recently had a client come in here that did the perfect derma peel, and she's come in like without makeup several times, and I'm like, your skin is good. She's like, everybody's been telling me that. Everybody's been saying that. And so that just makes me more apt to like, I need to keep up with my own chemical peels, but then also not leave it out of the treatment plan for people. I think a lot of times skincare and things like those maintenance stuff get pushed aside because we're talking about the big stuff like the fillers and the Sculptra. When this stuff is literally more important is your foundation. I mean, the most expensive thing you'll ever wear is your skin. You need to take care of it. Spending $4,000 on fillers not gonna fix your problems. Like, you have to take care of what you're investing in. And so that's how you do that, is with things like the chemical peels and the skincare. These are your foundations. So I do believe that everybody should experience a chemical peel. I mean, even if it's just the light one, you're at least getting those skin cells to turn over and keeping that skin healthy in general.
And for me, back when I was actively doing consults and helping with skincare more than what I do now, I would look at a couple different factors, and this is something as a client that you can think about. What kind of downtime do you have? If you don't have 3 days to where you can stay under wraps or not be seen, then if that's up to you, really. For me, I did the perfect derma. I did some peeling, but I wanted to do some peeling, which honestly for me, I went out and about. It was like a conversation piece.
Shows you what your skin it needs to get rid of. Like, whereas
Exactly.
I am a 20-step regimen girl with retinol. Like, I peeled very minimal compared to how she peeled, but we also have different skin types.
I wasn't using my retinol like I normally do, and that's something else we need to talk about too. You get the big chemical peel, and then you need to keep up your retinol, but that goes back into what kind of client are we dealing with? What kind of client are you? Are you someone that's going to are you going to keep up with your retinol every night? Excuse me. Are you going to keep up with your retinol every night? Which you need to, but if you can't, you may be one of these people that need to get to
Big peels
larger peels a year. It's really depending on what kind of downtime, how much money are you wanting to put toward this? Are you going to keep it up? Are you good with maintenance things? Are you not good with maintenance things?
Well, it's all about investing. If yourself and your looks is something you're investing in, then this is an area you need to invest into.
Yes.
Otherwise, you're kind of just throwing your money away. You have to take care of the foundations. your filler will look better, your results, your anti-aging products, just anti-aging in general. Like retinol is the number one, and retinol is one of the key ingredients in these chemical peels.
It is.
And preconditioning for them and after.
Yep.
So number one anti-aging tool is going to be retinol.
Retinol.
But the reason why we're talking about peels is this time of year is the best time. Typically, if you do like a perfect derma peel, which is one that you don't have to precondition for, it's great for all skin types. You will get some big peeling. That's typically going to happen day 3 to 5, I would say, is like the biggest time to peel. Now, Becca, I think, started peeling the next day, but she's a drier skin type.
It was like the beginning of day 3. Yeah. It was a little earlier than most, but like I said, I wasn't using my retinols. I had all that dead skin.
So I got mine done on a Tuesday, and like Saturday, Sunday was Tuesday, and then it was like Saturday, Sunday. So mine was later, but also, I mean, I could tell that I was red and like sunburny almost, but I was like, oh my gosh, am I gonna peel? And it did come. So you just want to plan for like that 7 to 10 days. You can't wear makeup. Obviously, we're just trying to get all this. So plan for that week. I mean, I feel like it's more acceptable now to walk around and you're just like, mind your business.
I did. I'm not gonna lie. I used it as a conversation piece. That's the way I did it.
But you can plan like work week. Okay, I want to peel during the weekend, and that's our job, is to help you determine when your bad peel days are going to be. You know what you've got coming up, but also let's choose what's right for you. What are you trying to accomplish here? Our acne scarring people, our wrinkles, our deep texture type problems, the ZO chemical peeling preconditioning your skin is going to give you best results. Now we can do the perfect derma peel and do more of those to get you there, but that just is more time. So if you're looking, it just depends on, you know, your time frame and what you're looking for results wise.
And you have to keep in mind, a chemical peel, the goal is we're going to chemically exfoliate this skin off. Like it's going to chemically exfoliate it off. So they're all going to initially essentially do the same thing. So what you want to look for is like what we're talking about with what issue is being brought forward. Okay, let's say we have a 30-year-old client, female, that has some melasma. We know with them having melasma, we do not want to treat with lasers. So right out the gate, lasers are off. But then you're going to want to get to that medium depth. And then you're going to want to make sure it has either some glutathione or some kind of kojic acid, something that is going to brighten the skin and help with that pigment.
And protect it, because we want to shut the melanocytes down.
Exactly.
So that's what's causing your pigment. So the 3-step peel is going to fix the problem, but it's not going to prevent it. So we want something with the glutathione to shut these cells down. So the perfect derma peel is going to be better for our hyperpigmentation people.
Yes, and now the 3-step peel is still going to help with hyperpigmentation, because essentially you have to think it's just going to peel that top layer off. Everything's going to be pushed to the surface, so everything on the top layer is going to be lighter. But that does not mean it was designed for that.
He's the workhorse.
Yes, he's the workhorse. You're still going to get results from it, but like I said,
our maintenance man is the guy that comes in there and cleans it up, which is going to be your perfect derma peel.
And well, for this specific issue, now if you come in and fine lines, wrinkles, you know, things that you were talking about, if that's more and you have no hyperpigmentation, we're going to ZO 3-step peel. You see, and then it really just depends. And like for me personally, I probably need to be doing the perfect derma twice a year and then doing a lactic in between.
Right.
Just to keep, once every month, 6 weeks, something like that, just to keep that cellular turnover rate, because I don't do well with retinols. I have psoriasis and other things like that, and also I'm one of those people, I'm not the best with my maintenance. So for me personally, that would be a better avenue for me. So there's different ways that you can get to the same end goal. You just need to have a talk with your injector or your esthetician, whoever you're with, and make sure they know what they're talking about to be able to set this plan out.
Here was another big thing though that kind of made the perfect derma peel stand out to me, is that it has phenol.
It has phenol in it
to prevent the burning pain. I feel like the 3-step peel's
intense. It's intense.
Tough. It's a very intense peel. So I feel like if you have somebody who's afraid, doesn't do well with pain at all, you know, you've got these people that can tolerate something. But this is a burning. I don't like burning pain. I am the one, like, I will put threads in myself. I'll do everything, but I do not like to be burned. So for me, the 3-step peel, I don't care if I've got to do 4 perfect derma peels. The fact that I don't have to go through that burning pain, I rather go that route. So there's different reasons. Now, for instance, if you have a bunch of wrinkles, then you're just going to have to do several
Sure.
of the Perfect Dermas.
You're
to
still
get the
going to get the
result,
results. It's just
not a one and done.
Exactly. And honestly, though, chemical peels, as we know, if you're listening to this education, it would make sense as to why these are not going to be one and done type things.
Because
Because
maintenance programs.
well, your cells are still going to regenerate. Hopefully, that's the goal. We want them to
Or you're
regenerate. Yeah. So that means this is going to be something that you're going to have to upkeep, whether that is within retinol in a daily regimen, or I prefer doing both. That's for best results.
But the two most common things I throw into my yearly plans with patients is a good chemical peel at least once a year. I try to get them to do, and a microneedling package
Absolutely.
to maintain the results that we've worked so hard to get.
Yep.
And my people that are, here every 3 to 4 months for their Botox are my clients that I see do this the best because they're invested. So these are things you don't want to just do one and done, then you're not buying any skincare or doing it. Like, you will get great results, but you're not maintaining or preventing anything from happening. So you're just going to be back at square one. So
Well, here we are with the cellular turnover rate once again. I'm 33.
slow and slow.
Exactly. So for me, if let's say I was to come in and do a one and done peel, like what we're talking about, these clients, well, in 30 to 40 days, my skin would look great for 30 to 40 days. Then guess what? All that buildup is right back where it was. You know what I'm saying? So that's where the maintenance of daily retinols come in, or tretinoin.
This affects not just that, it's your collagen stimulation.
Absolutely.
It's
Permeability of your products that you
Right.
put on your face. It has to get through those dead skin cells to even go to where it needs to go to work.
I've had so many people tell me like they're using these anti-aging products but not retinol.
Mhm.
They're like, I really don't see a difference. And they come in and I can see that texture on top of their skin. And I'm like, well, first off, we're in their 50s or 60s and we're not using a product to turn those cells over or exfoliate. They don't
Exactly.
exfoliate. And so you're just putting Band-Aids on.
And we're actually seeing more skincare lines switch their moisturizer before retinols. And that just proves to me that you have to have the skin to be preconditioned or even where it can permeate through for it to be
Right.
utilized correctly. So if you have this dead skin just on your face at all times, whatever product you're using is going to that depth, and that's pretty much it.
Right.
So all of your products are going to look better. I mean, all your results from your products are going to look better. Your makeup will light. So that's my favorite part.
Your
It's so
complexion,
smooth.
like trying to buy all these products, especially over the counter, that balance your skin tone, like it's not gonna work. They don't have the medications in them because they're over the counter, unfortunately. Like, they have to be prescribed. So you're spending a lot of money on all this stuff you're getting over the counter, all this makeup to cover up the flaws
Yeah.
that you could, just by doing maintenance, you don't even have to worry about. So if you cancel out the problems we create and the stuff that we purchase to cover these things up, you're saving a lot of money just taking care of your skin and being healthy.
Now you have to. That's so true. That's something you have to think about. Is yes, it's chemical peel season, but it's also the driest season. Which it's a great thing and it's a bad thing. We have to go through different seasons. It's just how it is. But when you do a chemical peel, you want to be as dry as you can be to try to get that slough off. Now, we always give moisturizer with it. So if you're afraid of, the things that I was afraid of, the being raw around the corners, that's literally what I could just imagine in my head, having chapped lips almost. We always give a hydration, some type of moisturizer or
It's a plan of
anti-inflammatory with it to, if you're uncomfortable, just apply it in those areas.
But it's like your doctor prescribing you a medicine that may make you nauseated and they give you something for nausea. Like,
exactly.
this is a plan of care. It's not just a treatment. Like, we follow you through. We follow those symptoms. The what ifs and how we'll treat them.
We
That's
enjoy
what
the
it's
pictures.
about. Yeah, that's what it's about, is like that support, that knowledge and understanding, and obviously the end goal and knowing why you're doing it. I think people will just get a chemical peel because they're like, oh, there's something I need to do. They have no idea why.
I was told I need one.
Right.
That was what
But
I get a
why?
lot of the time.
So why are you doing it, and what are you doing next? What's the point of this? Is it just for today? That's what we're trying to get rid of, is let's put some knowledge behind this and give you the reasons why, and also help you find your track to what you're looking for and what your end goal is, because everybody has something they don't like about themselves.
And I think that's a lot. You and I believe we're talking about it the other day. I think we were referring to dermal filler and how, one bad person can change an entire city's belief on filler. This is the same scenario. it's all about, I don't want people to have a bad connotation over aesthetics or any kind of product that we offer here. Most of the time, it was because they were not educated correctly, not given the correct product for the correct issue that they have. We just talked about chemical peels, and there's so many different.
With it.
Yes.
Wasn't a negative. I did not like. So I had been doing aesthetics, but I wasn't a professional on the skincare side, which I was losing a huge part of the whole purpose of what I was doing when I first started. The knowledge behind that was not given to me when I started. I was just taught how to do a procedure and why the procedure was great, but how do we maintain this? The science of aging and the knowledge behind your provider is key. Like, they know your skin inside and out. They know how it heals. They know how those cells turn over. They know how to benefit. They know how to stop the aging process from occurring. They know how to get rid of the flaws.
Yep.
That's the true knowledge behind this. And I did not have that starting out. And I had an esthetician that was doing chemical peels on people with no preconditioning, and that called for preconditioning. So they were having traumatic experiences,
Adverse
scar
reactions.
tissue, like crazy stuff that should never ever happen. So that was my belief, and I was scared to death. And now I'm like, oh, a chemical peel, big deal. It's because we have the knowledge to, one, give you the results you're looking for, but also keep the patient safe and choose the right client for it. It's all about the knowledge behind your injector, your esthetician, the place you're going to. So that's key. So make sure where you're going is teaching you things. Why are they trying to sell this to you? Why is it going to benefit you? What do you do before? What do you do after? And what's next?
Well, it's not your job as a client to know what chemicals and what ingredients are inside of a chemical peel.
Right.
It's not your job to know that, okay, I have hyperpigmentation, the Perfect Derma is going to be perfect for me. It's not your job to know that. It is the injector or esthetician's job to know that. But also, I've had so many clients come in here and say, I used this product for 3 months and I never saw anything. And I'm like, well, because that product is not even what you need. It's not. Yes, everyone needs to wash. Everyone needs to wash their face, of course. But that doesn't mean I'm going to use the same cleanser that you're going to use, that she's going to use. You understand what I'm saying?
Your cleanser is not going to get rid of your hyperpigmentation.
That's
so
exactly what I'm saying. It's all of that. It's all of that. You can get a chemical peel. Everybody can use one, but to make it the chemical peel for you.
Right.
You understand what I'm saying?
Right.
And go for your issues. That's why there's different ones.
So if they only offer one, then why is that one good for you? Is it going to get you what you need? So that's the questions to ask. And I feel like now people are smarter in the sense, like, we have access to ChatGPT, we have access to social media, so people are smarter. So they're coming into these clinics with knowledge as if they can actually physically do it.
Yeah.
And so it's okay to question in a respectful way. I'm going
to look up things before I go places.
Just to make sure it's right for you and that you get the questions, like, the background science and knowledge behind it that you may not understand, that you get that from the person that's consulting you or that's actually going to do this treatment on you.
Exactly. So really, but something you have to keep in mind, and I think you touched on this. Yes, you're going to get that chemical peel. Everything's great. You have to maintenance that with a retinol, with a tretinoin, depending on what kind of issues that you have. If you're more acneic skin, then we're going to look probably more toward a tretinoin, depending on what's going on.
And there's different I think the word retinol scares people too.
It does.
You don't have to use a tret or a 1%. Like, right now I'm literally using a retinol skin brightener at 0.25 because I'm baby stepping into it. I swear, since I've had my daughter, my skin is so much more sensitive.
But that's fine.
And hormonal stuff, obviously. So we have different strengths. You're not going to be walking around red and peeling all the time. Like, I think people kind of stray away from this because they hear these horror stories, but there's something for everybody, and that's what we're here to educate you on. We're to make sure your regimen is for you. Every single person coming in here is different.